Minister of Health, Dr. Dhlomo, Executive Mayor and MNC of City of Johannesburg, our partners from the US under the leadership of Ms. Lisa Merritt from US, members of the media, honorable guests, and other dignitaries, including the CEO of Johannesburg and the Chief Director of the District of Johannesburg. Let me take this opportunity to welcome everybody to this media briefing. This media briefing is meant to outline the government rollout of vaccines in our country. This is the first on-site media briefing taking place at the vaccination site, which is part of the ongoing efforts to monitor vaccination progress. As government, we have taken a decision that we will be conducting more of these media briefings to take the society in confidence regarding our vaccination rollout program and impact thereof. Our province is engaged on numerous initiatives to ramp up the vaccination program. Yesterday, Deputy Minister, we were with the Deputy President of our country, His Excellency David Mabuza, visited our province to monitor our vaccination drive and its effectiveness in our society. Our program went very well, Deputy Minister. We took the Deputy President through our vaccination program, which include testing of medical conditions such as hypertension and diabetes and other health-related conditions that we are currently providing in our vaccination sites. We also embarked on a door-to-door visit to address community concerns regarding vaccine hesitancy and anxiety concerning vaccinations after effects or side effects. Furthermore, as a province, we managed to expand and accelerate our vaccination sites. Since the 1st of September 2021, a total of 3.2 million vaccines were administered in our province. We are doing a sterling collaboration of work in partnership with private sector. Until this point, we have managed to put together a significant number of vaccination sites, and they are as follows, Minister. In Ekurhuleni, we've got 69 private sites, and then we've got 96 public sites, with a total of 165 vaccination sites in Ekurhuleni. In Johannesburg, we've got 170 private sites and 210 public sites, with a total of 380 sites in Johannesburg. Sidibeng, we've got 14 private, 66 public, and 80 total. In Tshwane, we've got 122 private and 166 public, with 288 at the total site. In Westland, we have 29 private and 86 public, with a total of 115 vaccination sites. To further fast-track our vaccination program, we have organized pop-up and drive-through sites as a direct intervention, particularly in areas where we are experiencing low vaccination uptake. The drive-through and pop-up sites are also used as a mechanism to direct vaccine to the most vulnerable communities, to address concerns around transport costs and accessibility. This includes areas like shopping centers, SASA points, and transport nodes like taxi rank. Minister, today our people are all over the province addressing those challenges of transport of our people that are in our pay points today. The drive-thrus are meant to consider work and family schedule convenience, and we have considered business parks and industrial areas to achieve this. The parking malls are also used as a drive-thru. They are also used as a drive-thru site, particularly on weekends. This has yielded positive outcomes, Minister. We have witnessed a substantial increase in a number of people using these available options to vaccinate on a daily basis. Our interventions are looking at addressing the low turnout at various vaccination sites. Hence, our focus is looking at improving access, taking vaccines to the people, and review site locations where applicable. As Gauteng, we have set ourselves an ambitious target of 100,000 vaccinations per day. Our efforts to partner with various stakeholders put us in a better platform to achieve this objective. Our plans are measurable and practical with high prospects of accomplishment. Our province is the most populous in the country. Therefore, vaccination programs must be multi-pronged and versatile enough to achieve a huge herd immunity in a reasonable period. Vaccinations is the only proven scientific solution that can assist us to bring back normality and our livelihood. We need to rebuild our economy such that we produce working opportunities to address high number of unemployment recorded recently by Stat SA. COVID-19 brought a lot of distress to our family structures. Joblessness and weaker economy resulted in mental depression and unstable homes. The more people take the opportunity to vaccinate, Minister, the more we are getting closer to the realization of the society we are familiar with. Vaccines save lives, and we must all vaccinate. Thank you very much, President Director.
Thank you, Honorable Deputy Minister. Indeed, we can win this fight if we all join hands together. Without wasting any time, I'm going to call upon our next speaker, who's representing the Embassy of US to provide the message of support. As we normally say, the fight against COVID needs all hands on deck. So we're going to allow our colleagues from the US Embassy to share the message of support. Over to you.
Honorable Minister of Health, Deputy Minister of Health, Acting Director General, Gauteng, Member of the Executive Council for Health, Johannesburg Executive Mayor, and MMC. All protocols observed. Ladies and gentlemen, good morning. Thank you so much for giving the United States Embassy and me the opportunity to join you here today. And thank you to the staff here at the Chris Hani Baragwanath Hospital for the life-saving work that you are doing every day, not only to protect South Africans from COVID-19, but also to improve the health and lives of your patients in whatever challenges they may face. In the United States and in South Africa, we know that healthcare workers are the true heroes of this pandemic. And we in the United States Mission to South Africa are proud to support your work. On behalf of the people of the United States, please accept our deepest condolences to all South Africans who have lost loved ones during the COVID-19 pandemic. This disease has destroyed lives in the United States, in South Africa, and throughout the world, and there is a grief that we all share. I could sit here beside the Honorable Minister and all of the illustrious VIPs and talk about the millions of vaccines and millions of dollars the United States has donated to fight COVID and other health challenges here in South Africa. But honestly, I think everyone here understands that situation. Instead, I'd like to use my short time to explain why South Africa is such a vital partner to the United States when it comes to the health challenges that our world faces. The health partnership between our nations is both broad and deep. One example is in HIV, where the U.S. PEPFAR program has partnered with the South African government and the NDOH for almost 2 decades on HIV prevention, care, and treatment. And together, we have saved millions of lives. But our partnership goes well beyond HIV. With the most advanced medical research facilities and most developed university system on the continent, South Africa is a critical partner in vaccine research, production, and distribution. The United States and Americans and South Africans joined together in the Ensemble and Sibongiseni trial to develop these life-saving vaccines. And together, we were also able, through those trials, to achieve early vaccination of healthcare workers. So we continue our vital work beyond those trials with the South African government and the private sector to manufacture and deliver safe and effective vaccines that are saving lives here and around the world. Honorable Minister, we applaud the Republic of South Africa's aggressive COVID-19 vaccination campaign, just one small piece of which we've seen this morning here at County. And we also want to applaud the South African National Department of Health's efforts to make reliable scientific information readily available to the public in many formats, setting the standard for how to end this pandemic throughout the world. I know that my president, Joe Biden, regularly tells the American people these vaccines are safe and highly effective. And I've been lucky to witness President Cyril Ramaphosa deliver that same message here in South Africa. I want to add my voice to that cry to say these vaccines are vital for the rebuilding of our economies and for the resumption of our partnership in a full way for tourism, for economic development, and urge every South African, every American eligible for vaccine to sign up today, not to wait. South Africans can access through EVDS and the many walk-up sites available. So please do your part for your mother, your neighbor, your worker, your colleague, your children, and sign up for that vaccination. Honorable Minister, we look forward to continuing to collaborate from the United States with the National Department of Health, with the tireless healthcare workers who are the lifeblood of hospitals like this one, and with the people of South Africa to end the COVID-19 pandemic here in South Africa, in the United States, and in the world. Thank you for letting us join you this morning.
Thank you for your ways and commitment to continue supporting the country and the government as far as contribution with vaccines is concerned. Without wasting any time, I'm going to call upon the Honorable Minister, Dr. Phaahla, to give us the keynote address of where are we here today. Over to you, Minister.
Thank you very much, Program Director, Mr. Mohale. Let me pass my regards to our host, the MEC for Health here in Gauteng, Dr. Nomathemba Mokheti, my colleague, the Deputy Minister, Dr. Dhlomo, Ms. Eunice Nqina, the MMC for Gauteng, Johannesburg. We had the mayor here earlier on. He's been with us when we started. And of course, our guest of honor, the Judge for the U.S., Ms. Heather Merritt. Thank you very much for your kind words and your friendship to South Africa. On behalf of our President, please pass our message of appreciation to Your Excellency, the President of the United States, President Joe Biden. As the people of South Africa, we are indeed very grateful for this great relationship and friendship of support which we have enjoyed over a long period between our people and the people of America, as represented by the government of the U.S. Now, ladies and gentlemen, just a quick update in terms of where we are. Firstly, just to say that, as we all know, that what we're all about here is to mobilize the nation in the fight against this invisible enemy called COVID-19, which has caused so much stress, so much anguish. So many people have lost their lives in South Africa alone and all over the world. As we speak, we in a situation where well over 82,000 South Africans have so far lost their lives due to this virus. And but we are grateful that we are a resilient country with very resilient leadership from our president, deputy president, and leaders of government across all spheres. The Premier of Gauteng really in the forefront as well. As MEC has said, Gauteng, it really accounts for what, I think about a quarter of the South African population. So as we are here to support, give support to Gauteng in its efforts as part of the national effort to fight the COVID-19 pandemic, we are cognizant of the fact that this province, small in geographic size, but in terms of population accounts for a quarter of the population of the country. So the Premier and this MEC have a lot in their hands. So I'm therefore to appeal to our colleagues in the media, let's be compassionate and considerate to these colleagues, because you know they really face a huge challenge. But we can see the commitment, and that's why we are also here to give the support. We are encouraged by the fact that overall, as we know, we are in this third wave now, which has proven to be quite a stubborn one. We've had experience over almost 18 months now from March last year. Yeah, exactly 18 months now in September. We had our first wave, which peaked around June, July in 2020. A second wave which peaked between December and January, December 2020 and January this year. And now we are in this third wave, which has proven to be very protracted. It's been going on. We know that the first epicenter when it started was here in Gauteng. And we are very encouraged by the fact that Gauteng has really stabilized. As we speak on a daily basis now, we see new infection rates of below 1,000 in Gauteng, which says therefore that Gauteng is definitely, you know, past its peak and is now really stabilizing downwards. But we are aware that in terms of the epidemiology, that from here, Western Cape has been hard hit, and then KZN is currently the most hard hit together with the Eastern Cape. But overall, we are optimistic that in the next few weeks, because I'm saying this because I'm sure having been on lockdown level 3, coming from level 1, everybody is asking, when are we going back to level 1, where we can have less restrictions, where there can be more movement, more activities in the businesses, the restaurants, and so on. I want to assure you that the government, led by President Ramaphosa through his various structures, the National Coronavirus Council and Cabinet, are very sensitive to these matters. But at the same time, as the President always says, we have to balance between saving lives and saving livelihoods. On the one hand, we know that the virus only travels through us as people. On its own, it doesn't travel. So when there is high levels of infection, as government, we do our best to try and reduce mobility of people. Now, the only way we can reduce mobility is through these various restrictions, including curfews and various aspects of that. So we are discussing this on a weekly basis. We are reviewing. Now, we are encouraged by the declining numbers. We will do our analysis from the Health Department, also advised by our Ministerial Advisory Committee, And if there is indeed a sustained decline, we are hoping that KZN also will start to decline, also Eastern Cape will stabilize, because the rest of the country generally is on a downward stabilization. So we will continue to assess this. We'll give a report to the President and the team of leadership in the next week. And if indeed, also with the advice of our experts, if it becomes clear that there is stability and the infection rates are definitely stabilizing, we will give the necessary advice. So you can look forward to some more relaxations, but that would still mean that it's going to be our responsibility, all of us, to observe the protocols. But I want to assure the nation that we are not oblivious of the pressure of the restrictions at current level 3. So we will give the necessary advice to our leadership in government to see whether there might be an opportunity to go lower down. And in this respect, we always also keep in mind our healthcare workers. It's okay for us, we know it's pressure on all of us, the kind of sacrifices we make, but we must always think of the frontline healthcare workers. And it's good that we are doing this briefing here at Chris Hani Baragwanath Hospital, which is one of our central hospitals, which carries a big load of caring for people who are infected with COVID-19 and also many other ailments. So I want to, through the CEO, I think the CEO is here as well, of Chris Hani Baragwanath, and other medical personnel, healthcare workers, we want to say on behalf of the nation that we are indeed very proud of you. We appreciate your sacrifices. We know that this is not just a physical pressure, but also from a mental side. This is the resilience which you have shown under so much pressure is highly appreciated by your government, but also by the nation as a whole. You might not hear it, but people, are really appreciative. Now, to show that actually that is the case, I think just over a week ago, there was a report of a survey which was done, I can't remember the organization, something Barometer. It's one of these organizations which do research, surveys about the attitude of people. They were surveying also about confidence of people in the leadership, including leadership of government. And some of you may remember it. Among the key reports, they were saying many people don't have confidence in the leadership and so on. That was the theme of that report. But what was outstanding in that report, they were saying, the TV person who was reporting, they were asking questions to the researcher. And then he asked the question, you've mentioned whether there is confidence in the president, in the government, and so on. And then he said, what about health? What are the people saying? And the researcher said, surprisingly to you, the actual finding was that health has got the biggest confidence amongst the people. And he said, surprisingly, and you could see that the gentleman on the TV was disappointed because he wanted to confirm that the confidence has gone down across the board. People have no confidence in every structure of government. And the researcher said people have shown a lot of confidence in the health sector. And then he said, but what is the explanation? So the researcher said, it's because when people are under all this pressure, they believe that, their lives can only be saved by the health, and they've seen people's lives being saved. Notwithstanding the fact that there are many who have passed away, but everyone can recount friends, relatives who were seriously ill, who went to hospitals and came back alive. So as a result of that, across government, He said, with all the problems. And the gentleman kept on saying, are you sure if you were to do the research today? He said, no, the people have confidence in the health sector. So I want to say to you that we are not just saying this, recognizing the work of the healthcare workers, but I was very, encouraged by the fact that even the public recognized the fact that notwithstanding the challenges, notwithstanding the fact that sometimes they do find long queues, some of their relatives wait a lot of time before they can get a bed, but they recognize the efforts of the healthcare services. So we want to say, hala hala to our health workers, hala hala. Thank you very much. Thank you very much. Now, we are here also to support the vaccination program, because we have said that all along until early this year, the only way we could defend ourselves against this invisible enemy was the non-pharmaceutical interventions, sanitizing our hands, wearing our masks, and all those social distancing. But since the beginning of this year, we've got an additional weapon, which is vaccination. So we're here to give that support and to give the encouragement to all our people to continue to vaccinate. Now, we want to again just say to everybody that please don't worry. We, on the government side, we know we struggled in the beginning. We started with the healthcare workers when we had some disappointment with the initial vaccines, with the variants. We then got into relationship also with the US through the J&J Sisonke, as the church mentioned, and we then prioritized our healthcare workers. Those were the difficult times. Once we, at the same time, we were busy building our capacity. We know that we came to a lot of criticism by various commentators, media people about the slowness, also in Parliament from opposition parties about the slowness of our vaccination. And we kept on explaining that this affects us beyond our control. The fact that you get a variant which does not respond to the vaccine we have purchased, and then we're able to make alternatives. But we are happy to say that today we can report that we have enough capacity. And from the government side, we have enough capacity to have the vaccine stock. I have with me here Dr. Nicholas Crisp. Many of you would have seen him responding to questions also, who's been managing our vaccination program. And he has assured me that in terms of supplies, where we are now, we can actually, even if the whole of Soweto was to turn up, we can vaccinate them. We will be able to provide that enough vaccinations. The province has got enough capacity. You heard earlier on Ms. Mrawane was telling us here, just in Soweto, that the 10 main sites, but also outreach sites. You've heard the MEC also mentioning the number of sites all over Gauteng. And thanks again to our healthcare workers who are also managing the vaccination. So we have the capacity also with the vaccinators and the vaccination sites, but also thanks to the private sector. A number of, you know that there's a number of private sites, pharmacies, medical schemes, and so on. So in terms of capacity, I want to assure South Africans that we are ready. All that we need is your arms to come through so that we inject you. Otherwise, on our side, you are ready. But we are happy also that as much as we would wish more people to come forward, we have the capacity currently with all the sites, with all the mobile sites, to can actually do what the president has said, between 300 and 400,000 vaccinations a day throughout the country. It can be done. We do have that capacity after building it over the many months since January this year. But we are pleased that people are still coming in numbers. We are able to do over, currently we can handle over 300,000. So far, the highest we have reached, I think some days ago, up to 270,000, 280, I think on one day even 290,000. So the numbers have been vacillating between 250 and up to 290,000 a day. So, but we do have adequate capacity. Up to now, up to last night, overall in the county, we're just under 1.4 million vaccine doses which have been administered. So we're not far from reaching 1.5 million doses of vaccines which have been administered. Now, in terms of the number of people who have been vaccinated, we are approaching 10 million. As of last night, we were at 9.7 million. So very soon we will have at least one dose. But those who have been fully vaccinated, just over 6.3 million. Now, when we say fully vaccinated, we mean either a J&J single dose or a 2-dose Pfizer vaccine. So where we are currently, ladies and gentlemen, we can say that just under 1/4 of the adult population have had at least a jab. That's a 24.5%. That's a quarter of the population, just a 0.5% to reach a quarter of the adult population. But of course, when we look at the entire population of 59 million, that's out of 40 million. When you look at the entire population of 59 million, just over 16.5%. But remember that the other 20 million or so between zero, is there a year zero? No? Yeah, between year 0 and 18. Those are not yet for vaccination. So that's why we characterize percentage of population, even though we're not vaccinating the entire population, but we'll also give you a sense of the adult population. So now we are very proud that with all the challenge in terms of number of people vaccinated, with the big population, Gauteng is of course leading in those numbers, just under 700,000 people who have already been vaccinated. The next bigger province being KZN, and also Eastern Cape and Western Cape, also just a little bit behind. But in terms of vaccination per population, as of yesterday, the Western Cape was leading in terms of the number of vaccinations per population, especially per adult population as we calculated. So our provinces are all moving. We have taken the decision under the leadership of our Deputy President, the leader of the Interministerial Committee on Vaccination, to give practical support. As the MEC was saying, DP was with the Premier in Mohale City yesterday. I was also with some of the MMCs in the West Rand, in the Randfontein, Mhlakeng area yesterday. So all of us who are in that Interministerial Committee were supporting Gauteng yesterday. So today we are here also to give that kind of support. And we're going to be moving to support the next province. I think is going to be Northwest, and then Mpumalanga, and then we go on. But on various days, we'll be out there giving practical physical support to our provinces. Just to speak to a few topical issues, the question of the mandatory vaccination. Even as I was coming here, there was a lot of debate in the radio about whether to force or not to force employers and so on. The position of government is very clear that our priority is to mobilize and convince people to come forward voluntarily and take the vaccine. That's really our main thrust of our strategy, is to speak to people, explain to them whatever their fears, and be able to deal with those fears so that they can come on their own accord to come and receive the vaccination. Of course, we're not oblivious of this debate, but we leave that to industry, employers, and that's really the debate which should happen, not in the government, but out there in terms of, we are conscious of the fact that as people want to get more and more freedom, this issue is going to be quite topical, because the question will always be, is there a way in which either as an employer or as a provider of services, you can determine a policy to say in my restaurant only those who are vaccinated will be allowed. That's really a society's matter, which must be debated out there. And service providers, employers, they must just work within the law. If the law allows that, that debate must carry on. But at this stage, it's not our priority to even start thinking about some kind of legislation or regulation which says every adult must vaccinate. That's not our priority. So we want to just observe that debate. We are not going to get involved. We leave it to those who run industries and services to continue. But on our side, what we are discussing, and our team will be reporting to government in the next week or so. In the next few days, we want to finalize that. What we are looking at, ladies and gentlemen, it's more encouragement. That's what we are focusing on. And amongst the encouragements we are looking at is to give some nice goodies. You know, as we go towards Christmas, people want some presents. So, but we're not talking about another cash payout. No. I know the U.S. government can offer $100 for that. We don't have that kind of money. So what we're looking at is, are there other soft kind of incentives? For instance, in terms of the fact that people are hungry for entertainment, for music festivals, to go to Orlando Stadium across here to go and watch a soccer match. So what we're exploring is the possibility where, with some kind of confirmation that you are vaccinated, we could start opening up various activities, sports, cultural, and business, and more business, and other, you know, kind of get-togethers, where we could start opening up to say, if you are vaccinated, so many people can go to soccer stadium to watch a match if they are vaccinated. Those are the things we're exploring. If you are vaccinated, if you can prove that, so many people can go to what is the Newtown to enjoy some music, you know, those kind of things. That's what we are looking at as incentives, so that people can start to open. They can be a benefit, not just because I'm saving my life, but I can start to access more and more activities because of the fact that I'm vaccinated. So those are the things which we are looking at, and we hope that you will support us when we come with some guidelines. We have been talking to the sports people through together with Minister Mteto. We also spoke to the artists, again led by Minister of Sports, Arts and Culture, to say that we can do this kind of thing together. Just the next point I just want to pass over is the issue of the variant called C12. Just to say that, as you would have seen, our scientists have reported, and thanks again to the kind of scientific expertise we have in this country. There are very few countries which can actually do viral genotyping. Very few, and we are amongst the few with the kind of science where they can study the virus and see wherever it's changing. They've given us this, that they observed this new variant, but at this stage they've assured us it's not really a threat. They've just observed it, they are watching it. It's just been picked up in various provinces, I think in all 9 provinces, in very small numbers, and in a few other parts. So at this stage, they said to us, we shouldn't worry a lot. But I want to say that what is almost certain is the fact that from the experience we have had since last year, it's almost given that there will be another wave somewhere down maybe by the end of the year or wherever. So that's why we need to speed up our vaccination and encourage more and more people to come forward to be vaccinated, because that will save us in terms of death, in terms of serious illness, people ending up in ICUs, all those we have seen the proof that indeed this will help. Vaccination for there have been a number of questions about vaccination for undocumented migrants. This is also work in progress, but it's almost there. Our team, led by Dr. Chris, has been working with Home Affairs. we will soon be able to have some, because all that we need, we want everybody to be vaccinated or to have a chance, including those who might be even illegal in the country, because they are here. So all that, the challenge has been, how do you record them if they don't have a document? But I think they are making progress with Home Affairs to can provide some form of identification. So the last issue which I want to touch on is the issue of a new functionality on the registration system. And I'm sure when there are questions, Dr. Nicholas Crisp can respond to that. But all that I want this says is that we have now reached the stage where we have a capability for people as they register on the EVDS to can even determine when they want to be vaccinated, where they want to be vaccinated. You can put it there and choose the date and look at various dates and make your own booking. Once you see where the opening is, you can say, I want to do the vaccination on this day at this time, and make your own booking. And then if you want to, if there's something changes, you want to change, you can go back using your cell phone number and your ID number or passport, and then with those, you can also amend your booking. It will give you a one-time password, which will then allow you to reopen and be able to change even the booking. So we're trying by all means to make the system more and more user-friendly. And I hope that especially our young people who are playing with their gadgets, but don't just book, change the booking 5 times because you know, because then you'll confuse the system. We just say people must not exploit it. Just be reasonable in terms of changing the booking. Let me leave it there, and I'm sure Mr. Mohali and his friends may just have some couple of questions. I hope not difficult ones.
Thank you, Honorable Minister, and all the members of the panel. They've spoken. Now we are going to take this opportunity to allow members of the media to also have a chance to talk, because we are here to interact, to discuss issues of common interest. So I'm going to take the first batch of questions, and I'm going to plead with the journalists that if you feel that your question has already been raised by somebody, you don't have to repeat it, because the answer will be the same. And also to save time, because we still have got another stop in Maponya Mall from here, and we also invite members of the media to call us. But the formal announcement on how and we'll be going to the next stop will be made at the end. The minister has said that the government will mobilize enough vaccines. We are happy. We've mobilized the personnel, the capacity. We are happy. Now we have to work together to mobilize the arms, as the minister said. We are mobilizing the arms, not necessarily the people, but the arms. So I'm going to first take the first batch of questions. Please, as you introduce yourself, your name and the media house where you come from. I see you can't wait to at least be brief, at least the one question per person, so that we can give others a chance to talk. But otherwise, we're going to be here throughout the day. We understand that we've got a lot of burning questions. And I'm going to then first check with our members of the panel if they've got their pens, the papers ready, so that once I say go, you'll be able to note all the questions. Be straight to the point. Sir. Oh. The mic is only one. So look, we've got only one mic. If you can just raise up your hand, your voice, so that you can be.
Let me check. 1, 2, yeah.
Yeah. Okay. Yeah. Good enough. Just that mic and move with the mic.
We must protect you.
Yeah. Your name and the media house you come from.
Check. Minister Lamens, Angelo Coppola from China Global Television. Yesterday, the special envoy to the AU made note of the fact that Johnson & Johnson had agreed that no more vaccines are going to leave the African continent. I want your comments on what that's going to mean for the South African vaccine drive and for the African vaccine drive.
Okay. My sister, you're next.
Good morning, Minister. This is Phaahla from Jacaranda FM News. Yesterday, the Deputy President, David Mabuza, told us that the target is to reach at least 40 million South Africans by December in terms of vaccinations. I just want to find out from the Health Department, how feasible is that target? Do you see it happening, that you will reach 70% of the population by then? And also, isn't it going to be a complication also with the fact that there is suggestions that it could be there could be a fourth wave during that time? Thank you.
Who's the next person? You're done. Any other question before we allow the... I understand that most of you are waiting for your own exclusive questions one-on-one. Any last question before we hand over to the Minister? Gone. Minister.
Thank you very much. The issue of Johnson & Johnson supplying the African continent, this we must emphasize that has actually been in the main through the initiative of our own president, President Ramaphosa, starting when he was the chair of the AU, establishing an entity called the African Vaccine Acquisition Task Team, AVAT. So you would have heard from the CEO of AVAT actually making that announcement. So the agreement, therefore, with Johnson & Johnson was to curtail, there was a lot of criticism about vaccines being produced in Africa, in South Africa, and largely being exported to America and Europe. So there's been this kind of agreement and understanding that the African continent will now be the priority in terms of the supply of the Johnson & Johnson vaccines. So now this doesn't, when we say African continent, that also includes our own country. So we have a very clear agreement with Johnson & Johnson. There's been some teething problems earlier on, you remember, about the contamination and so on, but the supply is now improved, and we're expecting a lot of stock, of which we have confirmed with Johnson & Johnson. So South Africa will not be negatively affected. We're very happy that a lot of stock will now be prioritized to supply the African continent, so that, and especially that it's a one dose jab which provides full coverage. So with that, the gap between Africa and the rest of the world can be closed. So we know that still a lot needs to be done because for the continent to arrive at the 60% coverage is going to take a lot more. But this contribution by Johnson & Johnson will go a long way in terms of closing that gap. But definitely, it will not disadvantage the supply to South Africa. The issue of population immunity. What we are targeting ultimately, indeed, is to cover 70% of the population. Now, you can look at it in terms of, even when I was giving where we are now, just over 16% of the population. But when you look at the targeted population, which is the adult population, already at 1/4. So we're taking this step by step. At the end, we would wish now to reach the 70%, but practically also that's going to be down the line, because it would mean, especially when we reach a stage where we can even go below 18, because otherwise, the current approach because as you know, we've been going in terms of risk, starting with over 60s, over 50s, 35s, and now over 18. Over 18 for two reasons. One is that many of the vaccines are approved for use in the adult population. There are others which also have been tested for below 18. You know that there are some countries where they've already started vaccinating below 18. There are a number of reports which are coming now, and a lot of other research. In fact, just yesterday, one of the manufacturers was sending me a message that they are going to be starting their trials on below 18. So most of them are still, there are 1 or 2 which have already tested below 18. Now, in terms of our priority, in terms of risk, we prioritize the adult population. So, as before we reach 70% of the full population, the next step is to reach at least 70% of the adult population. And once we have done that, then we can go to 70%. So our aim is still to reach 70% of the population, and that will go hand in hand with when more vaccines are approved for also below 18. Because when you look at the numbers, otherwise, to reach 70% of the population, when you are only your target population, it's not 100% of the population. 40 million out of 60 mathematicians? What percentage of the population is that? So probably about 70%, 60 something. So because currently we're prioritizing 40 million. Otherwise, to reach 40 million or 40 million would be almost an impossible task, because there will be various people for one reason, notwithstanding also the fake news and the vaccine hesitancy. But the 100% achievement is almost maybe impossible. So we will, as an interim, strive to reach 70% of the adults. Once we have reached that, whether we could be able, we hope that at least up to 90% by December of the adults. And then we can go down as the vaccines also get approved for the below 18. Then once we go below 18, the chances of even 70% of the full population will be possible. I hope that helps in terms of the strategy. Thank you.
Thanks. Yeah. The last round? Heidi?
I was surprised that Heidi didn't have a question.
I did, but they had asked already. Thank you. It's Heidi Jackas from ENCA. I just want to ask the Minister what your plan is moving forward in terms of dealing with hesitancy and misinformation regarding the vaccine. That is going to impact you directly in terms of meeting that target of 40 million, as many people are still hesitant and what they call anti-vaxxers. What is your plan and strategy to target that?
Any last question before?
Newsroom has a question. I haven't asked it.
Okay, let's finish this side and go this side.
Thank you. Mr. Minister, it's Dhlomo from Newsroom Africa. Just on the question regarding the activities and rewards that you are planning for the public, you mentioned things like gatherings or handing out sports events and things like that. Are you not concerned going into the new wave and with the ambitious targets of vaccinating the population that you might be working against reaching herd mobility, or what? Immunity. Herd immunity. Is that not working against what you are aiming for when you want to promote these kind of things? Thank you.
Just another one in relation to hesitancy, and maybe MEC, you can also come in. Yesterday you confirmed that the department had worked with some families in terms of doing postmortems for people who had died after vaccinations. I just want to know also from the health department, has there been any, and what number is it, of the collaborations between you and families of people who have passed? How many, do you guys have numbers of how many postmortems you have done together to check what exactly happened? You to MEC, you didn't actually tell us the number if there is yesterday. You just told us that you might have. I don't remember the number, so maybe you can come in there.
Thank you. Yeah, it looks like we're done with the questions, but members of the media must feel free to do the one-on-ones after the formal program. I'm going to hand over to the MEC, then the Minister will follow.
Yeah, thank you very much for that question. Yesterday I did mention that one of the vaccine hesitancy and one of the challenges that our communities are raising is that vaccines are killing our people. Then I said we have not, as Gauteng, we have not received or we did not, what happened is that there were 2 families that reported deaths that they think it was related to the vaccine. Maybe I did not clarify it. One was from one of our health workers. The family thought that it was related to the vaccine hesitancy. And then because she passed on 3 days after she got the vaccine. One of the family that was also raised a concern was here in Soweto. Then we have requested joint post-mortem. We worked with Sisonke to make sure that they are doing the post-mortem and test and other tests. And then none of the 2 was related to the vaccine. So I tried to explain that even in the community when they were raising that, remember there was a young man who was saying about 6 people in his street passed on because of COVID. I said there's a number at the back of the card after you're vaccinated. If there are any complications or if you think that somebody passed on because of the vaccine, call that number so that we can be able to work with the family and make sure that we do a joint post-mortem. So far, none of the deaths are related to the vaccine. Thank you very much.
Can you just ask Dr. Chris maybe just to add in terms of the national adverse effects?
Okay. Good morning, everybody. Morning, Minister, MEC, Deputy Minister. So far, what people need to know is that there is a strict reporting system, and it is available. There's a website, and it's called AEFI, Adverse Events Following Immunization. It's a program that we've been running in the country for years because of the childhood vaccinations where we get reporting. So it's been expanded to accommodate the reporting on COVID vaccine. So from that process, doctors, nurses, even patients themselves can report any adverse events. We're not talking about small side effects like you got a headache afterwards. That's quite common. We're talking about adverse events. And but anyway, anybody can report, and then it goes through a process of investigation. There's a team in every province that investigates every adverse event, including deaths that are reported that happen after vaccination. During that process, all the deaths, there is a post-mortem done and a thorough analysis by that clinical team of the records in, from the hospitalization or if the person died at home and so forth. And then from there, the protocol goes to a committee called NISEC, which is the national committee that deals with all adverse events and looks for what we call causality. So people do die, and they may die after a vaccination that has nothing to do with the vaccination. So the process of establishing causality is what is important. And so far, of the more than 50 that have been investigated, not one has been attached to and shown to be causative. So it may be associated with in terms of the time, but some of these patients already had COVID when they were vaccinated, and they have died subsequently from COVID infection and complications in hospital. Others have died from something completely unrelated to COVID, largely because of other comorbidities that they may have had, and they may have died anyway. So we are monitoring very closely. You can now go onto the SAPRA website. You will see it's fairly technical and you need a bit of time to understand all the definitions, but the tables of what is being reported and the outcomes are all on the SAPRA, SAHPRA, which is our regulator, on the website. Thanks very much.
Thank you, MEC, and thank you to Dr. Crisp. In terms of hesitancy, is indeed a big challenge. Nevertheless, we have been quite impressed with the fact that despite all the fake news, a lot of South Africans are coming forward, including the young ones. But we are also not complacent. So our team from health, working with the national team of health workers focusing on vaccination, working with the whole of government, especially led by our GCIS. We are working with various partners to improve our messaging, simplify, also make sure that it's available in all languages, explaining even the often asked questions, the things which we are picking up in terms of why many people say why they will not get vaccinated. I mean, you get people saying it's going to cause infertility, you know, so we need to deal with those the kind of fake news. You get some men being worried. They've had stories about what the allegations that the vaccine causes certain kind of disability for men, which is not true. So all those things we're trying to respond to. And of course, as Dr. Crispus indicated, we have to be meticulous whenever there's a claim that somebody died because of the vaccine. I mean, people go to ridiculous extents. I mean, just to show how actually the drivers of fake news can be really so unscrupulous. I mean, it was shocking. Was it the day before yesterday? The Deputy Minister sent me a message which one of our MECs had picked up on some WhatsApp group. You know, one of our comrades who passed away. And they put a poster claiming that he died after coming here at the vaccination where we had been. That he was vaccinated, and then because they know that he is from here in Soweto, that after vaccinating he went home and died. And it was totally fabrication. I was very happy to see the family actually stating it upfront and very clear that there's nothing to do with this comrade had not been to any vaccination site, was not COVID positive. There's something else, natural cause, which happened. So that's what desperate people can do. So we continue to do our best in terms of communicating. The team is working to improve our messaging. Also, there are a lot of partners who are coming forward, media houses, which are offering their newspapers, television stations, various other news channels, who are making their platforms available free of charge, so that we can be able to spread the message, the positive messages, and dispel all this fake news. So that is, we're doing our best, and we're happy also. We must appreciate also the fact that thus far, most of our media, our mass media, radio, television, newspapers have been really very supportive. Yourselves here, generally, I mean, you're giving us a lot of airtime, which adds very positively. That's why you find a lot of people notwithstanding the fake news. But we will be working very hard. We're working with, also, as I've mentioned, the artists are coming also to the party. The sports people, you would have seen a few, rugby. Deputy Minister was in Mangaung last weekend with the Cheetahs, a rugby team, where they were vaccinating publicly. So we're going to have more of those, you know, people who are prepared to come forward to help us dispel the fake news. In terms of whether the incentives you are discussing may not have the counter effect, what we are talking about is a very careful observation still of the protocols. What we are looking forward is, unlike a situation now, if you look at sports, for instance, where the policy is sports can carry on with absolutely no spectators. What we are looking forward to is a kind of gradual system where we may say 100 spectators, maybe at the covered venue or open venue, maybe 200, 300, and keep on increasing as we get experience in managing the protocols. And down the line, I mean, we don't envisage going the route of some of countries in the Northern Hemisphere, like in Europe, where you see already full stadiums. I mean, I see that the US is also very brave. I'm a keen watcher of tennis, and there is currently the US Open, and the Arthur Ashe and all the stadiums are almost full to capacity. We were not that brave to go that route. We will go gradual. We will go gradual, maybe 100, 200, 300, until we are more comfortable that we can have maybe 1,000, 2,000, once things are really, really, really very stable. So we believe that that will give people the more encouragement to see the benefit economically and socially of participating. But we will not take a chance of getting too risky, and so that we may end up reversing some of our gains. So I hope that puts your worries at rest. Thank you.
Thank you, Honorable Minister and other members of the panel and media partners. We're now going to allow the Deputy Minister, Dr. Sibongiseni Dhlomo, to do the official closure. Then we'll be followed by the one-on-one questions afterwards. Over to you, Doc.
Thank you. Good morning, and thank you, Mr. Foster Mohale. Greetings to our Minister, Minister Phaahla, our MEC, Dr. Mokheti, Ms. Heather Merritt, our US Ambassador, and the delegation that is accompanying her, our Councillor MMC in Johannesburg Metro, Councillor Eunice Mgcina, and the media and all our colleagues. Let me start with an important announcement that when we finish here, our MEC, Dr. Mokheti, will be going across Maponya Mall to join the Premier Makura. They are putting up a pop-up drive-through site. They are starting right now. When I asked MEC Mokheti why are they doing that, they say it's a pension pay point. It's a pension pay day today. So I'm inviting the media, I'm inviting our senior citizens in Soweto to go in there. There's a special arrangement for the drive-through and the pop-up site for vaccination. So we think it's very important to be there. One of the important messages that our minister is charging us to keep on talking about in the department regarding vaccines, there's quite many, but I remember this one. It says it's addressing all of us. It says, when you were small, I took care of you to the clinic to be immunized against rubella, measles, polio, and the rest. Now it's your turn to take me as a senior citizen, your grandmother, your mother, to vaccinate. So it's a very sentimental message, which I always write down when the minister mentions this, and I think it would be very important to share that with all of the colleagues. We want to thank the minister for raising our expectations about the incentives. And I think, Minister, the world is influencing you so positively. You are watching the US Open, last week of tennis. 2 weeks ago, you were telling me you were glued up to the Euro 2020. So the world is really influencing you positively. We would like to encourage you with those discussions that you are having with Minister Mthethwa, that really we are looking forward to that, and we would really be excited to see that happening. I always ask the minister, why are you keen to see this happening quickly and faster? They say, we want to make sure that by the time maybe we get a fourth wave, it may be so insignificant in terms of hospital admissions and deaths.
that we will still be getting COVID infection, but it must not get us to ICU. And therefore, that is why the minister is driving us so strongly to make sure that we all vaccinate as quickly as we can. By come December, we have reached quite a big numbers. He's saying February this year, we were really, really scanty on vaccines. No more now. We have enough vaccines. We were not really strong on capacity. Now there is vaccination sites all over the country. So really, I was encouraged by you, Dr. Mukhethi, with your ambition of about 100,000 vaccination per day. Now, you are the epicenter, and there's always this belief in the country, unless and until Gauteng pushes, nobody else will. So you'll be encouraging other provinces to do the same. So we thank you very much on that. And we want to thank the support that we have received from the US government. I was checking with Dr. Nicholas Chris, and I hope he told me the right figures, that we have made donations to us up to close to 10 million vaccines. And we thank you for that. And we rightly thank you, Dr. Phaahla, because therefore they see a responsive government in you, that when you receive these contributions, you use them very meaningfully. With those exciting stories that we hear, there's a self-booking live. I asked Dr. Chris, what does it mean? He said, Dr. Dhlomo, when you go to the airport, not everybody goes there to line up and get this. They just go and do their self-booking. Now, that's what they are actually saying. So it means the youngsters who know these things better can therefore self-book themselves to be, where could I be vaccinated? So, Minister, we thank you very much for this. If there's anybody I've left out in terms of this, is maybe it's an omission that I didn't expect. But Minister, I can't wait to see the goodies that you are promising us. Thank you very much.
Okay, thanks, ladies and gentlemen. This brings us to the end of this media briefing. As I said, journalists, feel free to ask a few one-on-one questions, but note that the minister needs to quickly join another parliamentary session before 10. Thank you.
Who's first? Don't take it out. I have a one-on-one.